Let's play that video for context before we speak to the MEC.
First one. When I was kind. You speak Shona. And then how do you find yourself in Villa and when you are supposed to be with Munangago there? You know he doesn't give me money to operate you guys. And I'm operating with my limited budget.
Thank you so much. I appreciate
well, you can't appreciate that. You're killing my health system. You are killing my health system. When you guys are sick, I'm hearing these days, you just say, let's cross Limpopo River. There's an MEC there who's running charity department. It's not. And I'm going to tell you something that is truthful and painful. You know that SA goes and count people during the census and tell me that in Limpopo you have got 5.7 million people, and tell me out of that 5.7 million, 91% do not have medical aid. They are dependent on the state. 9% they will say has got medical aid, they depend on private hospital. And then they go and give National Treasury. When National Treasury allocates its budget, they said Limpopo has got 5.7 million people, and they subtract the 7%, 9%, and they give me the budget of the 91 to do all these operations. Now, I am here, instead of using the budget for what it's meant for, I'm operating for what Mnangagwa is supposed to do.
And the MEC for Health in Limpopo, Dr. Ramathuba, joins us now. A very good morning to you, MEC. We know that things can be altered these days, so perhaps let's start by confirming, is that you in that video? Do you recognize that conversation?
Morning, Desiree, and morning to all your viewers. It is indeed me on that video.
One may say that the message might be valid, but the way in which is delivered is unbecoming of a leader. What would you say to that?
I think Desiree, firstly, I need to appreciate the fact that this issue is no longer our issue as the Limpopo Department of Health or departments of health in the country. The country is now talking about this issue because the already overburdened healthcare system is now coming to its knees. If I'm to give the context of that video, because it has been cut, whoever who decided to circulate it, and it might appear from someone who was not there to interpret the message the way there. Now, South Africa has got a constitution, and Section 27 is very clear that we shall never deny anyone emergency healthcare services. And as a province, including myself, we stick by that. On a daily basis, we're admitting foreign national, illegal or illegal, they're there, they're receiving healthcare services. And we have never been raising and complaining about that. But you know, being a rural province which is under-resourced and having serious challenges when it comes to the backlog surgical procedures, we came up with this initiative that says Rural Health Matters. And this initiative, we are very selfish about it because its aim is to make sure that the people in the rural part of Limpopo, the poorest of the poor, have access to specialist care. They've been sitting for years with surgical backlog and not being attended to. Now, this is the second year we started, and this month we were able to pride ourselves to say we have operated more than 4,700 cases. But what became a problem to me, Desiree, was when I checked these numbers, we are still as if we're not doing anything in terms of backlog. And the reason when we speak to most of our specialists, because the people who comes and do this operation are not necessarily coming from the province. We have got professors from other parts of the country and even overseas. And we go and recruit them and they are coming at no cost. But the only issue is that most of them are coming originally from Limpopo, and that's why they become biased, and they do agree and understand when I plead with them to say, come help me to clear this surgical backlog of our brothers and sisters and our mothers in the province. Now, what we have noted, why we are not even making a dent on these surgical backlogs, is because there has been abuse of this project by illegal foreign nationals.
I just want to ask you, having watched the video, do you stand by its contents and how it was delivered?
That's where I'm coming to say I do stand by its contents, because I need to give that understanding to say we are not doing anything to our surgical backlog because people are abusing. And that's what I was saying, that you are abusing the system. When they hear that the MEC is coming to this district with specialist care, they leave their country, enter South Africa illegal, come to our hospitals. The doctors who operate them, for ethical reasons, even though the constitution will cover the doctors, but for ethical reasons, they don't refuse to operate them. But what is this thing doing is that very same South African and the Limpopo citizen whom we did this project for, it's unable to get operated because they are still flooding even our initiatives. This is where the challenge is, because this is an initiative outside our daily work to say, let's be initiated and make sure we operate our people in the province.
But MEC,
we are not making a dent because, yes.
Why attack a patient who's under distress?
We did not attack the patient. If you look at that, we did not. If you were with me in the morning when we started with the first patient who was involved in an accident and was even proud to say, I got an accident in Harare, but I was told that there is a Dr. Phophi in the province who brings specialists in this rural hospital by my brother, the brother is also illegal in the country. I came and get the operation. Those are the videos that will not be taken and trend. Now, when we came to this particular patient also, we interview her, which is not the part that is there. She was laughing and smiling, thanking us for finally getting an operation.
Yeah.
And it is my responsibility. The doctors will not refuse. I needed to explain to her. I needed to educate them. I'm not going to wait for the National Health Insurance to tell the illegal foreign nationals that you will not be able to get access to elective healthcare services if you are not documented. Because if you look at that NHI, it's very clear that everybody will have a card to access. And we don't want to discuss those things as South Africans.
So, MEC, I want to ask you this. If you have to get to the point of lashing out at patients, does it mean that diplomatic efforts between South Africa and Zimbabwe or any other country for that argument are failing?
You know, we have been discussing these things at a National Health Council level for years. We have been asking that we must be reimbursed as the South African government, especially provinces like ours, which are bordering, and provinces like Gauteng. Our SADC partners are willing to pay private hospitals in these countries millions of rands, but they are not willing to reimburse the state hospitals, which is attending to the millions of their citizens. So we reach a level wherein we need to start educating the patients themselves and ask them the fairness part of it. I have just this morning a domestic worker whose son, 17-year-old, fractured their leg while playing soccer, and it's on a waiting list to be operated, and he must go and write his exams, and he can't because he's waiting list. When I check who is before him, it's foreign illegal nationals. And this is a problem for us. The other area that I must indicate why I raised that issue, that we have operated here and we won't stop operating them, but they must pay. And we are saying this because you as South Africans, when you enter public hospitals, We then classify you from H0, who are those who are pregnant women and elderly. We classify you H1, and H3 will be me and you who have got medical insurance. And if you are legal as a foreign, we also classify you like we do with South Africans. But when you are illegal, we can't even classify you. That is why the law says, the tariff says, you must pay the full amount. And all I was saying to the doctors, to the management, because the doctors have done their part, is that, look, we are the ones who are not implementing the law. The Constitution says no one shall be denied emergency care. If South Africans found me in maternity, lashing pregnant women, or in casualty, lashing people who have got accidents, there will be something. Yeah. I was here explaining to a patient, because I even said, let me explain to you how this thing works. The problem is our system is already overburdened. We come up with initiative and programs to address our challenges, but these programs are being abused and manipulated, and we are not winning, because when we speak to our counterparts, we are not getting that joy. Then do I sit down and fold my arms?
Yeah. You speak about counterparts. Just a few weeks ago, the Foreign Minister of Zimbabwe, Frederick Shava, was in South Africa, also making a plea to Zimbabweans to respect the host nation's laws. Were you able to take part in that conversation? What sort of messages were sent through to the Foreign Ministry, just in terms of how Zimbabweans conduct themselves in South Africa?
As you are saying, it's a national, at a national level, and I believe my minister, my capable minister, would have represented our views, because these are the discussions that we always do, together with even the Minister of Home Affairs, who, by the way, we support fully the work that he's doing. And maybe it's because he has been a Minister of Health, and when things go wrong in Home Affairs, the people who feel the brand, it's us service delivery departments like your health, your social development, your housing. The reality of the matter is that South Africans are competing for these limited resources with illegal migrants. The reality is that out of the 5.7 million people that we have in the province, only 91% are dependent on the state. And on top of it, I have got 2 million plus people who cannot be counted for, who even when Treasury Minister Godongwane allocates money for Limpopo, he speaks about the only 5.7 million. He doesn't talk about these 2 million that we don't know. So we are saying it's a high time that we need to also educate, especially these ones who just cross the border, because we are having a litima to clear our own problems as a country. We have got an obligation. For me, as an MEC for Health in Limpopo, my responsibility is to make sure that the people of Limpopo live a long and a healthy life. And if I'm able to clear surgical backlogs for Limpopo, I will start with Mpumalanga, Northwest, and all those before I think of SADC.
MEC, I want to ask you this.
For us to be expected.
I want to ask you this. In government, there exists a term called protocol. And also on the parallel side, there's a conversation in the country right now about ministers overreaching and getting involved in operational matters. Were you the right person to be delivering the message to the patient?
It is the responsibility of the MEC for Health in Limpopo to make sure that the people of Limpopo live a long and healthy life. When people of Limpopo are waiting to be operated and they are not getting joy, they come to no one other than myself. And when there are challenges that I see are affecting even our initiative as a province, I will have to address those challenges. So yes, I will have to deal with anything that has to do with health issues in my province for the sake of these people of Limpopo. You know, there's one thing you must remember. These people whom we said they must be beneficiaries of the Rural Healthcare Matters project, they are not me and you. They don't have any other option. Their option is the public health services in the Limpopo Department of Health. These other ones who are foreign nationals illegally, They have gotten options for their country to serve them. Now, their last hope of the Limpopo people, which is this Rural Health Matters project, when it's being hijacked, it is again defeating the very same last hope that a child of a domestic worker would be operated and go back to school, probably graduate, and come and help her mother to take care of the mother. Now, he might remain disabled for the rest of his life because as government, we would have failed the people of Limpopo to make sure they have got that access to quality health care.
MEC Phophi Ramathuba, thank you so much for making the time to speak to us. There you have it, the MEC for Health in Limpopo saying no regrets about the manner in which that probably valid message, but just the way in which it was delivered.